Okay, let's talk about something every pediatric practice has, that little treasure chest of toys. It's been around forever, right? But here's a thought. What if that well-intentioned tradition is actually putting a cap on your practice's growth? So, if you're a pediatric dentist or a practice owner, this is the question we really have to ask ourselves. Seriously, are those little plastic prizes actually building good, lifelong habits? Or are we just handing out clutter? Is it just a tradition that's kind of lost its impact?
Well, the tough answer is that it's creating a structural ceiling on your growth. Think about it. Your biggest challenge, the real friction point, isn't happening in your chair. It's happening miles away, at home. It's that nightly brushing battle every parent dreads. And that little toy from the treasure chest, it does absolutely nothing to help win that fight.
So, let's break down what I call the sticker problem. Because this old way of doing things, well, it's failing. And it's failing in ways that create these hidden costs for your practice, costs that go way beyond just the price of those little trinkets.
First off, there's the environment. I mean, where do all those treasure chest toys even come from? Well, the toy industry is actually the most plastic-intensive industry in the world, and a staggering 90%, yep, 90% of toys are made from plastic.
And where do they end up? Landfills, oceans, you name it. Now, just picture the sheer volume of these little prizes being handed out every single day, in every practice across the country. It adds up, and it makes our traditional prize system a surprisingly big contributor to plastic waste.
Okay, but honestly, the environmental cost is just one piece of it. What's even more important is the psychological cost. What are we actually teaching kids? We're teaching them to focus on external rewards, the toy, the sticker. They're doing the task just to get the thing, not for the internal feeling of accomplishment, not for that pride of taking care of themselves.
And that's the real kicker. The treasure chest model, it completely fails to build that internal drive, the one you need for real lifelong habits. It's just a short-term transaction. It's not creating a long-term wellness mindset. All right, so if the old model is broken, what do? Where do we go from here? The answer isn't just to find better, shinier toys. No way. It's about a complete shift. It's about changing the reward system itself to speak a language the kids today actually understand. And that shift is called gamification. It's a bit of a buzzword, but the idea is simple. You take game design elements and you apply them to something that's not a game, like brushing your teeth. It completely transforms the dynamic. That nightly brushing battle, it goes from being a dreaded chore to a fun challenge. A duty becomes a game.
So why does this approach work so incredibly well? Well, just look at your patients. We're talking about Gen Z and now Gen Alpha. These kids are true digital natives.
I mean, they've literally grown up with a screen in their hands. Their world is all about apps, getting points, leveling up, these constant interactive feedback loops. Gamification is so smart because it doesn't try to fight that. It meets them exactly where they are. It uses the platforms they already get, bridging that huge gap between your clinic and their bathroom at home. Okay, this all sounds good in theory, right? But let's look at the real world. Let's put this play to work, because this delivers actual, quantifiable results, both clinically and for your business. When you can get home care compliance on autopilot, the impact is, well, it's huge.
The clinical data is pretty mind-blowing. Check this out. A clinical trial from the University of Sydney found that using a gamified app more than doubled the effectiveness of brushing. That's a massive difference.
And it gets even better. Other studies have seen even more dramatic results. Imagine a 63.4% drop in plaque scores in just 3 months. This isn't just a tiny improvement, you guys. This is a complete transformation of patient outcomes.
And this right here, this shows you the business impact. Look at this shift. Home care goes from being reactive to proactive. Your chair time, it stops being about high-volume rework, fixing stuff that could have been prevented, and becomes about high-value care. And the parent, they're not the bad guy anymore. They're your partner in this. So let's look at how this actually works in the real world. We can use a platform like the ERNX app as a quick example. And really, the key isn't the tech itself, it's the sophisticated behavioral psychology that makes it tick. What these platforms do is they turn oral hygiene into, well, an epic quest for the kid. They use all these cool mechanics like customizing their own avatar, earning treasure, getting winning streaks for brushing every day. All of this stuff taps directly into that internal motivation we were just talking about. Suddenly, the parent's biggest daily headache is solved. And guess who they're grateful to? You. That builds some seriously fierce loyalty to your practice. Okay, so let's zoom out. Let's look at the big picture here. and what this all means for the future of your practice. Because this isn't just about patient care anymore. This goes right to the core of your entire business model. And really, the choice comes down to this. Do you want to keep being a reactive service business? You know, the classic drill and fill model, fixing problems that could have been prevented. Or do you want to build a proactive, scalable asset, a whole wellness ecosystem that, by the way, comes with a much, much higher valuation? At the end of the day, adopting a model like this is about protecting your margins. It's simple math. Every single minute of chair time you spend on avoidable rework is a minute you're not spending on higher value, more profitable procedures. This approach just flat out builds a more predictable, more successful, and way more valuable practice.
So I'll leave you with this final thought to chew on. The old model, it stops the second the patient walks out your door. But the future of pediatric dentistry is about extending your care right into the patient's home. It's about turning that daily chore into a daily win. If your biggest obstacle to growth is happening in your patient's bathrooms, well, isn't it time your practice finally showed up there?